Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Urology, it's a big subject. There's so much more now to do with urology than years and years ago. We have an expert that's going to share some of the latest ideas and procedures. Dr. Vlad Gorbatiy.
Thank you.
Graduated, actually, he graduated at a lot of schools, a medical school, and he's been practicing a long time. But what I like is that he's a part of the Broward Health at the General Hospital and also at Imperial Point. And so we do a lot of things there, and it's very, very important that you listen to the latest and the greatest procedures. And Dr. Gorbatiy, I have to tell you that I always think of urology as a man's specialty, but we know now that women have lots of urological problems.
Absolutely. We men and women share a lot of urologic problems. So many things, simple as kidney stones to, as people get a little bit older, maybe occasional leaky bladders. Yes, we are also fixing those problems. But
I'm glad you brought that up. Do men have more problems with leaky bladders or women?
Well, it's a touchy subject, I think, and the problem is that a lot of men just don't tell us when they have a problem, and that's always a fight with men to disclose to their wives or their doctors what is actually going on in the bathroom sometimes, and women are a lot more open at sharing their problems with physician, but sometimes don't know all the available treatment options for leaky bladders. The guys, on the other hand, you have to sometimes push them, and sometimes they only come in when things are at their worst. So
I'll give you an example of what happened. I had a radio guest not too long ago, and it was an older gentleman. He was a physician, as a matter of fact, and as he was leaving, I noticed that his pants were a little wet, and so I bring this up because women are used to wearing sanitary pads. And now as they started to have some incontinence, it was easy for them. But to tell a man that he has to have a pad on is a lot difficult. More difficult. I guess that's what you're referring to.
Yes, but, sometimes when a man is leaking urine, there's a lot more happening than just maybe a weak support structure that tend to happen often in women as they age or if they've had multiple children. In men, that's usually a sign of bigger things, bigger problems. So it's always more important sometimes to have a guy evaluated by a urologist or their primary doctor if they're starting to have leakage. But I think, as you just mentioned, the pads and the commercials that we see on television all the time from women makes things a lot more easier to bring up with the physicians, and I think it's also a duty of of the physicians to bring up those kinds of issues that, especially as people age, to kind of put that on the discussion table with the patients up front before they even maybe think about it. But in men, the only thing that's really made men open up a little bit is the fact that Viagra commercials are out there. And so those things are actually, we have a lot of men coming in for erectile dysfunction issues. But at the same time, they will disclose to us that they're also having urinary problems. And sort of that, I think as more of the public arena and the commercials and the the press talks about these intimate problems, I think we'll have more and more men open up to physicians as well.
Yeah, it used to be shameful, and for both women and men, and now it's not.
Right.
I heard, and maybe you know this, that years ago, if someone were incontinent, they wound up in a nursing home.
Yes,
and now we know that's not really what we worry about. But let's go further. So now you're interviewing, let's take a man. So you have a new patient. The patient comes in. What questions do you ask him?
Well, a lot of the things that we talk about have to deal with their lifestyle, surprisingly. You know, people think of immediately there must be some kind of major medical condition that may be causing some urinary problems, but a lot of times it's our habits. So it is the pressure of our society to work long hours and get up early, and then, we're trying to de-stress with a lot of habits such as drinking a little too much in the evenings, a little too much alcohol, or drinking, gallons of coffee in the morning, and that leads to a lot of urinary complaints. The other thing is that a lot of people are pushing a lot of water and fluids, and sometimes, that they overdo it. Some people just take the word of advice of whatever they read on the internet just way too far, and they can hurt themselves that way. And so we have to look at the balance of the lifestyle habits, the daily routine, how patients, how long they sleep every night. All those little things.
Wait. I'm not letting you get off without that one. What a difference does that make?
Well, we see a lot of patients having leaky bladders or a lot of nighttime urination from actually sleep apnea, for instance. Those things that they don't really, they're snoring and they're not really paying attention for years and years. And it turns out that might be a cause of, let's say, their urinary habits as well. So it is just like with, for instance, erectile dysfunction. That sometimes is a sign of artery problems, sometimes the blood flow problems, and that's really maybe a little flag of, hey, you need to also see a cardiologist and get your heart checked out. So a lot of complaints that people may have that are related to the urinary system might be a flag of other problems, such as lung problems, sleeping problems, or even heart problems. So, that's why our first visit usually in the office takes a little extra time. So, that's why some patients get a little fidgety, but at least the first time we have to dive into some of the bigger issues and understand the general habits of a patient before we jump into the technicalities of some prostate tests and bladder tests and pictures of the bladder and kidneys, those kinds of things.
I like your taking time with the patient. That's good. People want doctors to take more time. I'm going to go fast forward because
Sure.
I know that you also are certified with the DaVinci Robotic Surgery.
That's right.
So it sounds pretty fancy name. Tell us about that.
It's very fancy, but it's very simple as well. This technology has been around since the early 2000s. Essentially, what we're talking about is performing a large operation on a specific organ in your body, but instead of making a large cut on the belly, we can go through small incisions, and that is basically laparoscopic surgery. But what this device allows us to do is do a lot of more complex maneuvers with the instruments, such as stitching and more precise cutting, better vision than we've ever been able to do in the past. And so that allows us to do a lot more complicated operations, yet still through small cuts in the belly, which allows for people to recover a lot faster, use a lot less pain medications, and but bounce back to their normal habits much faster.
But of course, you're still in charge of the surgery, even though it's not a robot comes in. Okay, move over, Dr. Gorbati. I'm going to do it, right?
That's correct. Not yet. Maybe one day that's going to happen. But for now, basically, all we're doing is placing the instruments in the belly, and then I use joysticks to control those instruments on the inside, which allows me to operate on things like the prostate for prostate cancer or kidney for kidney tumors. And we're able to save a lot more kidneys this way by being able to cut out a small tumor out of a kidney, fix the kidney, and allow patients to basically save their kidneys. We used to do a lot of laparoscopic surgery since the early 90s, but a lot of, because of the limitation of instruments, we're only able to, let's say, just remove the entire kidney for kidney cancer. But nowadays, bigger and bigger tumors, we're able to remove just the tumor and save the kidney. So I do a lot of those kinds of operations that are, taking a number of years to get trained on to do, but they're wonderful, and I think this equipment, especially the newest robot we got at Imperial Point now, is incredible. It's called the DaVinci XI, and the vision is just amazing.
It's expensive too, isn't it?
Is
I know
expensive.
That's why not all hospitals
expensive.
have this.
Correct. I mean, it's a large and big investment. I think part of the problem is the fact that it is only one company making this product right now. But maybe in the future there'll be a lot more with competition. We'll see a drop in the cost of this technology. But you also have to kind of weigh on the other hand, you have to see that if the patient recovers faster, gets back to work faster, overall it might be a benefit for society in that that person may go back to work and produce a lot faster than we would normally see with kidney operation. For instance, would see people stay in a hospital for a week or two. Now, they go home in 2-3 days, and they get back to work maybe in a couple of weeks. So that made a huge difference. And obviously, when looking at cost, you have to look at the big picture, and then the long-term, recovery rate, and of course, the individual benefits that patient may have in terms of pain.
Definitely. But, I always ask most of the physicians, most of them when they come on, so, okay, now you're going to medical school, and now all of a sudden you have all these choices. Do I want to be a psychiatrist? Do I want to be a brain surgeon? Why did you choose urology? Or did it choose you?
Well, no, I actually chose it. I was blessed to be exposed to a number of really great physicians. I decided on urology when I was shadowing a physician who's known as the godfather of infertility, and he works in Baylor College of Medicine in Houston. And Dr. Lipschultz introduced me to a lot of young patients my age when I was a medical student in my 20s, and they were having a lot of intimate problems, and that really exposed me to a lot of interesting patients, first of all, and I thought that, wow, this is a really cool field in that a lot of patients tell us their most intimate, private problems, and if I'm able to fix that, that's great. Our field combines not only medical treatments such as pills and counseling patients, but also surgery. And so I've always wanted to do things with my hands. I think that's probably my something I inherited from my dad. He's a piano tuner, fixer, builder.
Oh, I love it.
So
he's a piano tuner. You said, okay, I'm going to tune the body, right?
Yeah, exactly. So I think that it combines a nice surgery, medical treatments, talking to patients. I don't sit in a dark room looking at x-rays. I actually treat patients, and that's what I enjoy.
So talk about cancer. How much do you deal with? A lot of cancer. What is probably the thing you deal with the most?
Well, we deal with a lot of cancer. Our field involves the entire urinary tract, so kidneys, bladders, testicles in men, and other private parts. But essentially, all of those areas may be affected with cancer. But the main organ that we probably deal with in terms of cancer is the prostate in men. It is still the leading cause of cancer or diagnosis of cancer in men. Around 240,000 men in the United States are diagnosed with prostate cancer each year. So we see a lot of men diagnosed with it. Not that many, though, die of the disease, thankfully, because A, we do have early screening. B, we also have a lot more treatment options than we used to have, let's say, 20 years ago. So it is one of the few cancers that we've seen a drop in terms of death rate over the past 20 years. Yet, though, our diagnosis a little higher than before, probably because we have so many early tests, blood tests, and other screening tests that can help us pick up early cancers.
So you don't have a lot of cancer of the kidneys?
It is not as prevalent as prostate cancer. However, it is still very common. Now, what's surprising about it is that most kidney cancers are found randomly. People come in with some other complaints. They get a CAT scan, get an MRI, checking their back for other issues, and poof, we find a small little tumor. So in the past, we used to, before all these X-rays were available, we used to typically find patients mostly with advanced disease. And nowadays, we're picking up a lot of small tumors. And with the advent of robotics, we are able to cut out these tumors early on while they're small, while saving the kidney. We also have a lot of other treatment options, including ablation, which is basically, we also do that at the hospital. And what that is basically putting a needle into the tumor and burning it or freezing it. So that's a really unique treatment option. I think is going to be more and more used in the future as you look at cost. That's probably one of the cheaper treatment option for kidney cancer.
Now, I had heard years ago about microwaving. Mm-hmm. Now, is that the ablation?
That is one of the technologies that we could use in burning a tumor out of the kidney. So yes, I actually did a number of cases while in training at University of Miami, using some newer microwave probes that do that. But yes, there's various new minimally invasive treatment options for kidney tumors as well as prostate cancer.
And so what about people who really have a kidney, with kidney transplants? Are you doing those? Is that a separate kind of
it's its own
medical,
little specialty. There are we're all trained to do transplant. However, each hospital system has their own type of doctors that they pick to do transplant surgery. So I think in the South Florida, most of the transplants are done by general surgery teams. But it's a special dedicated team because it is definitely a team approach to manage transplant patients. So you have to have a dedicated team that only focuses on that.
First, you have to find a kidney, too. You have to.
Right. Urologists do, however, get involved often if there are kidney stones that a patient with a transplant kidney develops, or there's some evidence of blockage of the kidney, or getting the donor kidney out available for a transplant. So
I'm glad you brought up kidney stones because it seems that nobody knows they have a kidney stone until they can't stand the pain. How are we supposed to know we're going to have a kidney stone?
Gosh, that's well. If you've had one before, then you should expect another one in the future.
Really?
There is a higher risk of getting another one if you've had one before. So, one thing is definitely seeing your primary doctor to get some urine tests sometimes that are helpful in predicting another episode of a stone. Unfortunately, that first stone that one might have is very difficult to predict. Sometimes a screening urinary test, like a urine analysis, might show a little bit of microscopic blood, and that might be an early flag of a little stone.
Are these really stones? What are these?
Microscopic blood?
The stone.
Yes, they are.
It's really a stone.
They are real, gravel.
It's gravel.
Yes, real stone. Mm-hmm.
And and so, how do you? If it's gravel, how are you getting that out? And what happens? People say they try to pass it without surgery.
Well, good question. Essentially what happens is that the stone is made in your kidney, which is located behind your ribs in the back, and then your urine drains through a very, very thin tube down to the bladder. And what happens is that the stone tries to go through that very, very narrow tubing, and that's where often the pain occurs or a problem occurs if the stone gets stuck. And obviously, a lot of patients try to push fluids and drink a lot of fluids to try to push that that stone down and out, and that's what they mean by passing the stone. But occasionally, we have to help them with some procedures. So oftentimes we use sound waves, which are basically, literally sound wave technology that sends a shock to the stone and it makes it crack. So that's one of the least invasive procedures that we do. It doesn't involve any cuts at all. All the other newer technologies that we use for treatment of stone also don't involve any more cuts on the belly as they used to 20 years ago. And they're all done with lasers and very, very small cameras. So
this
nowadays,
brilliant physician, Dr. Vlad Gorbaty, is really doing a great job in urology. I mean, you're answering questions that everybody's sitting home and say, "Oh, I didn't know that," or "Yeah, I wanted to ask that question." And I'm really happy that you've been able to do this with us. And so, what is endurology?
Endourology?
Endourology. Okay, I got that.
Endo, it essentially means that we can do a procedure through a very small opening, and typically some of the natural openings in your body. So, as we were talking about kidney stones, all of the treatment options besides the sound waves could be done through the urine hole, basically. Everything can be done with a little tiny camera. We can find the stones with a little camera. We can use a little laser, crack the stone, pull all the pieces out, and basically endourology means minimally invasive surgery.
So are you going through the
minimally
penis
invasive
to
urology.
go to do that?
Correct. We do that through the penis and the urethra in women, and essentially everything is done without with making the least amount of trauma possible, which allows patients to recover much faster.
So the cameras, this is wonderful to think about the little cameras.
Well, it's amazing because the digital technology just you can see everything on the inside so much better, and it's amazing. I don't know how we used to do urology before this.
Yeah, well, you're pretty young too, and so I guess if I was talking to someone who'd been practicing for 40 years, they would be aghast at what happens.
Right.
How is someone going to find you? What do we have a phone number of your practice? Or I'm sure. Let's just talk about that, because I'm certainly going to get my husband to come see you.
No problem.
What
I'd be
should
happy
we
to
do?
help. Our main office is in downtown Fort Lauderdale. It's at 1200 East Broward Boulevard, and we're essentially on the intersection of US 1 and Broward Boulevard.
Okay.
We do have an alternate office at Imperial Point Medical Center.
And people can visit you there?
Yes, at Broward Health Imperial Point.
Good.
It's right next door, building next door to the emergency department there. And our main phone number is 954-463-6408. And that's 954-463-6408. And we're very happy to help anyone and everyone.
Is the name of your practice?
Yes, it's called the Broward Urology Center.
The Broward Urology Center. Sorry, I didn't have that information, but I do now. That's really absolutely wonderful. So we've covered a lot of things, and I think that being a urologist today is pretty exciting for you, because you're dealing with robotics, you're dealing with microwaving, and people, of course, prostate. And I have a relative that did have a lot of. He doesn't live here; lives in Colorado, but he took over about 1.5 years, and he kept watching the prostate. It was up to 12 or something, but there were a lot of clinical studies, and he got into something very big then in California. So, and he seems to be okay today, but one never knows. Cancer is strange, isn't it?
Well, it's prostate cancer especially is a very tricky thing, because a lot of prostate cancers are slow growing, but it's hard to predict which one may turn into something more aggressive. And so we work a lot with our patients to figure out exactly how aggressive they sometimes want to be with prostate cancer, because nowadays we have a lot of treatment options including monitoring as your family member was doing.
Well, I will tell you something, and I've done a lot of shows with a lot of physicians, and we've talked about sex and so many things. And one physician said that the reason we're seeing, especially in older men, the reason that we're seeing so much prostate cancer is because a lot of men are not ejaculating very much anymore, and that he felt it was very important. It's an organ, and it's supposed to be used. And, of course, maybe many of them are not using it. Now, I don't know how you feel about that, but...
Well, there have been a number of very good studies showing that the more ejaculations occur, the lower risk of prostate cancer.
Aha! See, I was right.
Yes. Now, it's hard to judge whether or not this is a major worldwide problem. We certainly, I think a lot of our prostate cancer diagnoses have increased because of our very early detection rate and all our new blood tests that, on one hand might be over checking, over diagnosing people in a way, some might argue. But I think it's important that, we have this kind of laboratory test available for people. If they choose to get screened, I think it's very important, and it's up to the physician and the patient to kind of decide on what kind of testing they want done and what kind of screening they want done for all kinds of cancers.
Terrific, and thank you, Dr. Gorbaty. I have to say it was a pleasure having you on the show, and hopefully we'll get you back again, and maybe we'll even get you into our Cure Symposium, which will be coming up. We find physicians who are very distinguished and have a lot of information. We'll bring you into that.
Great. Thank you so much.
Thanks for being here.